This video is presented by Subi, lecturer from Emmanuel Arasal College of Pharmacy. Today, I am going to teaching about dentifrices. Introduction and types of dental products with the examples. Dentifrices, calcium carbonate and dicalcium phosphate. Dental caries or dental plaque, anti-caries agent, role of fluoride as anti-caries agent, consequences of fluoride overdosing, sodium fluoride and stannous fluoride. Next, we will see about introduction to dental products. The inorganic compounds and their formulations which are used in maintaining the oral and dental hygiene are known as dental products. Dental products include anti-caries agents, polishing agents, and desensitizing agents. Classification of dental products. Dental products include anti-caries agents. These are the agents which help in prevention of dental decay. Example: sodium fluoride, stannous fluoride, sodium monofluorophosphate. Cleaning agents. Dentifrices are polishing agents. Dentifrices are agents used along with a toothbrush to clean and polish natural teeth. They must be abrasive to some degree to remove the stains from the teeth. They are supplied in paste, powder, gel or liquid form. Example: calcium carbonate, dibasic calcium phosphate and sodium metaphosphate. Desensitizing agent. These reduce sensitivity of teeth to heat, cold. Example include strontium chloride and zinc chloride. Anti-caries agents. Example: sodium fluoride, stannous fluoride, sodium monofluorophosphate. Dental caries or tooth decay involves a gradual demineralization, that means softening of the enamel and dentin. If it is not treated, then microorganism may invade the bulb, causing inflammation and infection. Dental caries tooth decay is infectious diseases, also called a dental plaque, in which acid formed by the action of oral microbial flora on carbohydrates. Dental plaque is a biofilm or mass of bacteria that grows on surfaces within the mouth. It is a sticky, colorless deposit at first, but when it forms tartar, it is often brown or pale yellow. It is characterized by decalcification of tooth accompanied by full smell. The microbial flora, primarily Streptococcus mutans and Lactobacillus, present in the mouth, act on carbohydrates taken in a tea and food, etc., and produce acids, especially lactic acid. Calcium salts are dissolved in acidic media. Remaining organic matter is easily digested by the proteolytic enzymes and cavities are formed. Dental caries can be prevented and oral and dental hygiene can be maintained with the help of dentifrices. Dentifrices are the products that enhance the removal of stain and dental plaque by the toothbrush. The most accepted the most accepted approach to prevent the caries include flossing and brushing, accompanied by administration of fluoride either internally or topically to the teeth. Mechanism of action of fluoride. The deposited fluorides on the surface of teeth The deposited fluorides on the surface of teeth prevent the action of acids or enzyme in producing cavities. Fluoride is anti-cariogenic as it replaces the hydroxyl ion in hydroxyapatite with fluoride ion to form fluorapatite in the outer surface of the enamel. Fluorapatite hardens the enamel and makes it more acid resistant. It is also possible that fluorides may possess some antibacterial activity and help in remineralization of enamel. A trace amount of fluoride in drinking water is enough to prevent dental caries. Fluorapatite has also shown antibacterial activity. Next, we will see about sodium fluoride preparation. It may be prepared by neutralizing hydrofluoric acid with sodium carbonate. Another method includes the double decomposition of calcium fluoride with sodium carbonate, wherein insoluble calcium carbonate can be removed by filtration. Properties: a white powder or colorless crystal, soluble in water, practically insoluble in ethanol. Identification: gives reaction A of sodium salts. Add about 4 mg to a mixture of 0.1 ml of alizarin red solution and 0.1 ml of zirconyl nitrate solution and mix. The color changes to yellow. Test for purity. It is tested for appearance of solution, acidity or alkalinity, chlorides, fluorosilicates, sulfates and loss on drain. Assay: by accurately about 80 mg, add a mixture of 5 ml acetic anhydride and 20 ml of anhydrous glacial acetic acid and heat to dissolve. Cool and 20 ml of dioxane. Cool and add 20 ml of dioxane. Titrate with 0.1 m perchloric acid using crystal violet solution as indicator until a green color is produced. Carry out a blank titration. Action and uses. Sodium fluoride, due to its fluoride ion, is an important agent in dental practice for retarding or preventing dental caries. Fluoridized teeth have been resistant to microorganisms causing dental caries. It also decreases microbial acid production. Sodium fluoride in 2% aqueous solution is widely used topically. Occasionally, the solution is applied to the surface of dry teeth periodically over several times in a year. Application: 1.5 to 3 ppm in drinking water, topically as a 2% solution to the teeth. Caution: when consumed in large doses, sodium fluoride is poisonous. High fluoride water greater than 3 ppm brings about mottling of teeth, gastric disturbance, etc. Still, larger doses may lead to systemic toxicities affecting central nervous system, cardiovascular, musculoskeletal, and respiratory systems. Sometimes sodium fluoride is used as domestic insecticide. Greater precaution is to be taken to prevent children getting access to such preparation. Note: stainless fluoride is a valuable adjunct in the prevention of caries and is considered to be superior to sodium fluoride of two reasons: simplified application and greater effectiveness. The first advantage is supported by the fact that a single application of 8% aqueous solution to the tooth surface is enough for every 6 months to 1 year, while a 2% sodium fluoride is applied 4 times during a 10 days period. The second advantage derives from the fact that the stainless ion increases the anti-cardiogenic action of fluoride ion, so that both ions contribute towards clinical effectiveness. Next, we will see about stainless fluoride. Molecular formula SnF2. Molecular weight 156.7. The tin fluoride solution is obtained from using tin fluoride capsules by dissolving in water. A fresh solution finds use in dentistry. Properties: it is a white crystalline powder having unpleasant astringent salty taste. It is soluble in water but insoluble in alcohol and organic solvent. Aqueous solution of stannous fluoride deteriorates rapidly on standing because of oxidation of stannous cation to stannic form, causing turbidity. This stannous fluoride solution must be freshly made. Identification. To 5 ml of solution in a test tube, add 2 ml of calcium chloride test solution. A fine white precipitate of calcium fluoride is formed. Mix on a spot plate 2 drops of solution with 2 drops of silver nitrate test solution. A brown black precipitate is formed. Uses. It is used to prevent dental caries similar to sodium fluoride and sodium monofluorophosphate in the form of solution, gel, mouthwash or dentifrices. It has unpleasant taste and may cause discoloration of teeth on overusage. A freshly prepared 8% solution of stannous fluoride is applied to the cleaned teeth. A single application has been reported to be sufficient for 6 to 12 months. Next, we will see about differentiate between some dental products and caries. Examples: amine fluoride, calcium phosphate, calcium pyrophosphate, calcium trimetaphosphate, nicomethanol fluorohydrate, potassium fluoride, sodium monofluorophosphate, stannous fluoride, xylitol. These are the compounds act as anti-caries agents. Next, antibacterials. Chlorhexidine, fluorides, hexidine, hydrogen peroxide, plant extract, potassium peroxide diphosphate, cyanurin, silicglycol, sodium bicarbonate, stannous pyrophosphate, triclosan, urea peroxide, xylitol, zinc chloride, zinc citrate, zinc trihydrate. These are the compound act as antibacterial agents. Anti-malodor, chlorhexidine, triclosan, zinc chloride, zinc citrate. Whiteners: benzalkonium chloride, calcium carbonate, calcium phosphate, carboxymethyl cellulose, cetirizine, pentasodium triphosphate, potassium tetrapyrophosphate, sodium benzoate, sodium bicarbonate, sodium tripolyphosphate. These are all act as whiteners. Anti-tartar: azocyclopentane diphosphonate, potassium pyrophosphate, zinc chloride, zinc citrate. It is act as a anti-tartar. And hypersensitivity: formaldehyde, potassium citrate, potassium chloride, potassium nitrate, sodium citrate, sodium fluoride, stannous fluoride, strontium chloride. Others: enoxabolone, essential oil, keratin, panthenol, premethyl, provitamin B5, tocopherol, vitamin E. Next, we will see about cleaning agents, dentifrices or polishing agents. Dentifrices contains agents for cleaning tooth surface and providing polishing effect on the clean teeth. These agents are abrasive in nature. They are responsible for physically removing plaque and debris. The overall effect provides whiteness to the teeth. Dentifrices are applied as powders or paste. Examples include dicalcium phosphate, sodium metaphosphate, calcium pyrophosphate, calcium carbonate and calcium monohydrogen phosphate. The main drawback is that it will not be able to clean surfaces inside cavities and crevices between teeth even if the material reaches them during application. The cleaning action is depend upon abrasive property and the rubbing force used. Pumice is too abrasive for daily use in dentifrices. Dibasic calcium phosphate or dicalcium phosphate. This also known as dicalcium phosphate or dicalcium orthophosphate or calcium hydrogen phosphate. It occurs as a dihydrate. When exposed to air, it effloresces losing water to form anhydrous dibasic calcium phosphate. It is a very fine powder form. It finds use in dentifrices. It provides good flow properties and is odorless and tasteless. Preparation. It may be prepared by reacting natural solution of calcium chloride with disodium hydrogen phosphate. Uses. This salt is having 1:1 ratio of calcium to phosphorus. It is most frequently recommended for oral administration as an electrolyte replenisher. As a salt, it is able to supply both the calcium and phosphorus, which is needed for the growth in children, pregnant women, and lactating mothers. Externally, it finds use as dentifrices having cleaning action. The moderate abrasive quality makes suitable for toothpaste and tooth powders. Calcium carbonate. It has been regarded as one of the most abundant and widely distributed of calcium salts. In nature, it is formed as chalk, marble, limestone, aragonite, and calcite, and one of the main constituents of corals, pearls, and shells. Preparation. On commercial scale, calcium carbonate is obtained by mixing the boiling solutions of calcium chloride and sodium carbonate and allowing the resulting precipitate to settle down. The precipitate is collected on calico filter and washed with boiling water until it becomes free from chloride ions. Finally, the precipitate is dried. Properties. It occurs as fine white microcrystalline powder. It is odorless and tasteless. It is stable in air. It is almost soluble in water and alcohol. Calcium carbonate neutralizes acids with effervescence. Calcium carbonate plus hydrochloric acid to gives calcium chloride, carbon dioxide, and water. Identification. It gives reactions which are characteristic of calcium and carbonates. Uses. Precipitated chalk, which is having a fine powder texture, is used to dentifrices both powders and paste. It furnishes both abrasive and antacid effect in the mouth. It forms a common ingredient of tooth powder and toothpaste. It is having a tendency to cause constipation, and hence it is usually administered alternatively or along with the magnesium salt. It is rapidly acting non-systemic antacid. It neutralizes gastric acid and forms up calcium chloride. Next, we will see about desensitizing agents. Desensitizing agents reduce the pain in sensitive teeth caused by cold, heat, or touch. These products should be non-abrasive and should not be used on regular basis unless directed by a dentist. Examples include strontium chloride and zinc chloride. The exact mechanism of action of desensitizing agents is not known with certainty. However, they act probably like local anesthetic. Strontium chloride preparation. It is prepared by adding strontium carbonate to hydrochloric acid until effervescence gets cheesed. The solution is filtered, concentrated, and allowed to recrystallize. Strontium carbonate plus hydrochloric acid to give strontium chloride, water, and carbon dioxide. Uses. It acts densitizing agent in dental remedies. Next, we will see about zinc chloride. Preparation. It is prepared by heating granulated zinc with hydrochloric acid when evaluation of hydrogen ceases. The solution is filtered and evaporated to dryness. Zinc plus hydrochloric acid to give zinc chloride and hydrogen gas. Uses. It is used as an antiseptic astringent to the skin and mucous membrane as 0.55 to 2% solution. It is used as an active ingredient to prepare magnesium cement for dental filling and certain mouthwashes. Okay, it is used to prepare magnesium cements for dental filling. It is also used as dentin desensitizer topically as a 10% solution to the teeth. It is for topical use only and is administered a solution and mouthwash. Today class is over. We will see next class. Thank you all.